Thanks so much. And you very neatly given me a segue into asking Jeremy to come and talk about, I think, some of the work of the Bristol Carers Support Centre. And really to open up the conversation into this sense that caring just doesn't happen in institutions or organisations. It happens in and around the community. And we all have caring responsibilities of one sort or another, I'm sure. So over to you, Jeremy.
Thank you, Tony. We have, in our organisation, an initial difficulty to overcome, which is one of labelling and definition. So there is our definition of a volunteer family carer. And sorry, but we still get an awful lot of phone calls from people complaining that the paid carer that should be coming round to wash somebody hasn't turned up. But there you go, that's life. And remember that we are all, as a society, coming from, let's say, up to the Second World War, a static society and extended families. And all this work that we now do organisationally was all done completely naturally, informally. And people got married for better or worse, for richer, for poorer, in sickness and in health. And if your partner then fell on ill health, and remember, and of course that can stretch over a long time, there was what you might describe as the short straw shrug. You just get on with it. It's life. And you don't look upon yourself as a candidate for social services. And that still is very much a common attitude. And of course, for an awful lot of people, it needn't be a dreadful burden, especially if you are not in severe poverty. You can carry on an even keel, but then when something unfortunate might happen to the carer, an accident, their own illness, their own ill health, then suddenly crisis can loom really very quickly. Financial crisis, all sorts of other things. So here is, I hope, yes, there's a bald statistic that 1 in every 8 of us are a carer at some time in our lives. So my wife was a carer. Half the trustees of the Carers Support Centre are carers or have been. Most of the staff, who are nearly all part-time at the Carers Support Centre, have themselves been carers or still are, and so it goes on. Now, there is the local picture of carers in Bristol and South Gloucestershire. I apologise that all these figures have to come twice, because like many of you, you have to deal with the 2 local authorities. And I suppose if we have one overriding wish out of this conference, it is that they merge, but I don't suppose that's really a practicality. So there are the number of carers and young carers, and that's a southwest figure. These are all from the census, and of course we must bear in mind that all of these figures are going to be vastly underestimates, because of course so many people do not wish to divulge that information, or in some cases aren't even aware of it. And our organisation provides practical support with a very small staff and a rising number of volunteers, around 200 at the moment. And there are the figures on the unpaid care and the number of voluntary hours that are put in by carers at home. And our job is a lot to do with raising awareness amongst the authorities and the statutory agencies about the role of carers and their value. And we have very scarce staff, and so we're always looking for partnerships. For instance, my interest is in young carers, and we operate with a most wonderful partner called Chicks. And CHICs are country holidays for inner city kids. And so all we have to do is set it up and hand them over, and they go off and have this wonderful holiday. If our staff had to give them the holiday, we'd achieve far less. And so we've got to be very careful on the best use of our resources. Now, we've had in the last couple of years 2 very, very important major advances. And the first is with the NHS. We've now got the hospital boards have a carers charter. And I was the poor mug who happened to be around and sort of signed it in front of the local press and everything. A ridiculous occasion, but there you go, it happened. And so now our centre has a team and volunteers as well, both in the hospitals and in the general visiting the general practice surgeries. And this is enormously beneficial in spreading the word and spreading the influence and good things coming out of it. For instance, the annual flu jab exercise is the most wonderful catching net for discovering carers that we never knew about before. And out of the Carers Charter, that is now rolling out into staff induction and training. And the carer is now involved in their loved one being in hospital, especially, for instance, as it comes near to the time of discharge, and then returning to care at home. And also in the prevention of re-hospitalisation. They don't have to come back again. And that, of course, is easily understandable by the hospital authorities in money terms. And in the general practice, we're enabling the staff there to be more aware that it is an issue that the patient is then cared for at home, and that the carer's health is part of the package. And the carer's role is now acknowledged as a knowledgeable, valued member of the healthcare team. Now, I've got a bit of a bee in my bonnet about return on social investment. And we were fortunate enough for the NHS in Bristol to pay for a scientific, top professional exercise in measuring the return on the social investment of our work with the hospitals and the general practice as well. And the company was called Baker Tilly, and I don't mind advertising them because they were so good. And they took great care to take the lowest, most modest, conservative money figures of what is being saved to the NHS by what we are doing. And even with that, the value of our work in the NHS around Bristol was that figure, £3.6 million a year. Now, the commissioners of the project in the NHS found great difficulty in believing this, and they even went so far as to say that maybe we shouldn't advertise this. To which we said, get lost, of course we're going to, come on. And that is and I think we get the next one will show, whoops, doesn't do anything at all. 3.6 million, and then again, no, sorry. And the other amazing project at the same time was that we got embedded into schools for young carers in school. Now, there's an extra hurdle in trying to help young carers, and that is that the young carer will fear like hell that the family is going to get broken up and they're all going to be taken into care. So they do their best to stay below the horizon. below the radar. They don't want to be recognised by the authorities. And then what is absolutely very, very difficult to understand is that young carers are prone to be bullied at school. I do not know how this comes about, but it does. But now, far less. And we had a pilot 6-month project in 6 schools in Bristol. And out of that, over 70 young carers were recognised and made themselves known, or we spotted, that we never knew about before, and the schools didn't either. And it is so easy to reduce isolation for a young carer at school. All sorts of simple things like a lunch hour in a room as a group together, where they can talk amongst themselves and realise they're not alone in the world in what they're doing, and also a listening ear from a member of staff. And also making life more manageable for them, so that needing extra time to return homework and things like that. And that support is now really going in 14 schools and still rising. And again, the results are easily measurable by the school authorities, because what they like to see is improved school attendance and improved academic progress.